Hi everyone, I'm John Yershenko. I'm a health service administrator with mental health and substance use for Interior Health.
And I'm Sheila Turner. I'm the Executive Director of the Canadian Mental Health Association here in Kelowna.
Thanks for joining us this afternoon. As some of you might be aware, this week is Mental Health Week across Canada, and Canadian Mental Health Association has been raising awareness of mental health with the hashtag #GetLoud. But first and foremost, if you're experiencing a mental health crisis, please call the Provincial Central Crisis Line at 1-888-353-2273. With that in mind, Sheila, maybe you can tell us a bit more about #GetLoud and what it represents.
Well, the campaign #GetLoud is really about raising awareness of mental health and mental illness and making sure that people speak up if they're experiencing a mental health issue. Or, I think essentially the Canadian Mental Health Association realizes that stigma and discrimination are the barriers that people have to getting help. So that's really the essence of Get Loud. We want people to talk about how they're feeling, to show that they care, and to share with somebody that they love or respect what they're going through. So that's Get Loud.
Yeah, I think it's kind of like any part of being healthy is that it's on a continuum of being healthy, staying healthy, and then struggling with some signs of struggles with that health. So I think being aware of resources, being aware of how we connect with our community are actually really important aspects of being healthy.
Absolutely. And this year our campaign is really about mental health. You hear me talk a lot about the 1 in 5 people who experiences mental illness. Well, 5 in 5 of us actually have mental health, and it's knowing what are those things that keep us well when we're at work or at school or in our homes. And so I thought maybe today we'd talk about some of those tips.
Yeah, you can reinforce some of my learning, and maybe I can get some new habits that help me stay healthy.
I think you're a mentally healthy specimen.
There, thank you for that.
So one of the things that's probably cornerstone to mental health and well-being is connecting. Many people feel isolated, but when you have friends and when you connect with others, whether that's at work or just as a friend, out in the community, it really raises your endorphins and it makes you feel a part of something special. So being connected is a key component of mental well-being. So what are some of the ways that you stay connected?
Yeah, well, it changes for me depending on the time of year. So certainly this time of year in the beautiful Okanagan, it's much easier to connect with neighbors, have barbecues where family come, certainly spend more time with friends and have more activity. And I guess I would say in terms of connecting, that would be a time for me in the winter when I'm not into winter activities that I probably have less of those connections. So maybe a time where I need to be more aware of where I'm at with my mental health.
Yeah, good point, right? We can't tend to be hibernate and isolate in the winter. So, but it's really important to be mindful about being connected. So one of the other strategies is being active. Getting, as my kids, I have 2 daughters, and they say it's really important for me to get my yayas out. And so getting out on the mountain and hiking is important. Going for a run, a bike ride, just going for a walk. It's something that gets your blood moving. Does wonders for your mental health. So what are some of your
for me, I used to be a bit more athletic than I am now. For me, right now, we have a dog, so I'm the dog walker in our family for sure. My Cocker Spaniel, Casey, every morning gets me out of moving and out of the house before work, and the same in the evening, and trying to get her out on the weekends as well. So I'd say it's certainly low impact, but something that keeps me going for sure.
And we were just talking about that. That leads into a little-known mental health technique: having a pet.
Having a pet,
Hopefully the pets helps your mental health.
Yeah, hopefully it's not a stressful. My dog is a bit stressful at times, so but yeah, having a pet absolutely has been shown in lots of longitudinal studies to extend people's lives. So having a pet, I think there's probably lots of reasons for that, but having that connectedness, caring about others, caring about something, and keeping moving.
Yeah, absolutely. So, third thing,
Yeah.
is to take notice, to be mindful. So thinking about just being in this moment, rather than being, where we both have really busy jobs, and it's pretty easy to just keep going and forget that actually this is a pretty amazing thing.
Yeah.
We're lucky just to be here.
Yes.
We're lucky to be enjoying this gorgeous day today, and just taking a moment to breathe and being mindful. It doesn't need to be rocket science, really.
No, I think there's lots of ways that we can do that. There's formal kind of activities that can help us be mindful, like participating in some classes, some yoga, relaxation type things. But I think there's also those just in time, just in the moment kinds of things about noticing something beautiful, smiling, taking some deep breaths, and just being present. So I think all of those things are helpful in terms of you really being present and being mindful.
Yeah. So again, not so rocket science. Easy to say, hard to do.
Yeah.
So I guess as an employer, it's important to show that to model it. I guess that's the word, but also to help your teams to take a moment to breathe and help them know that that's okay.
Yeah, and I think, for interior health, with our staff, we talk about having a reflective practice, which means actually after you're working with somebody or having an interaction, that you take some time afterwards to actually think about that and think about how that was for you, and whether that was positive or less than positive, and what needs to be done in the future. And I think that's part of being mindful, is just being aware, and giving yourself the space to have that kind of thought about how you experience this situation.
Fantastic. So the fourth technique or fourth strategy is around learning and keeping your mind pliable and active. And so there's lots of studies, lots of research that when you challenge your mind and you can change it. You can in neuroscience, and so it's really important to keep it active.
Yeah.
What is it? Use it or lose it?
That's right.
So.
Yeah, definitely. And if there's one thing I've learned, is that there's always more to learn. There's no end of emerging things to read about. I've got a good friend who's prides himself on kind of his bachelor's in psychology background, and every time I go down to his house, he's always showing me a different program that he's seen on TV. And there's certainly a ton of resources out there now, both on the internet and on the television, as well as at your local library, to pursue your own individual interest in learning.
So making sure that you keep your mind active.
Yeah.
And then I guess the last big tip or strategy is to be useful, to give of yourself and to give to others. So as a nonprofit organization, it's incredibly important that we're built on the idea of volunteers and the support of volunteers. So when people you can kind of get all these strategies into one. When you're connected to something useful, and you're learning and you're active and you're a part of something special, that goes a long way to supporting your mental health.
I think that giving to others actually applies to a lot of these different areas you've talked about, and to give to others and volunteer requires you to have a level of activity. Hopefully it requires that you have a level of mindfulness and thoughtfulness in terms of how you're participating, and you're likely making connections with others as well, and being a part of a community that cares about an issue. So I think that ticks a lot of the boxes that you've talked about today. One of the other things I was going to comment on is being able to volunteer. There's lots of places to volunteer, communities, all the nonprofit opportunities that you referenced. Interior Health also has volunteer opportunities that can be accessed through the website, www.interiorhealth.ca. And if you just search for volunteer, it'll tell you in your local community how to connect through to somebody who might be able to help you with that. So put that out there for people that are interested.
Yeah, good job.
Yeah.
So then,
get our plug in, right?
I'm going to plug then the Canadian Mental Health Association Kelowna branch, and we're here. We've now created a byline that you're not alone with the Canadian Mental Health Association. We we really learned something significant when we started creating Foundry, and that the whole Not Alone campaign, people really felt disconnected, and being a part of something bigger than you gets you out of your head, and so it's really good for your mental health. So yeah, good job.
Yeah. So I think, you know, in summary, mental health and physical health both need to be paid attention to. They both need to be caretaked a little bit. So being mindful of how you're doing and connecting with others, participating, being active, all of those are good attributes. I think it's also something that requires some effort, and people need to think about it. It's something to do every day. Just like maybe getting your exercise every day is something to do that keeps you healthy. All those activities keep you healthy mentally as well.
Yeah, wonderful.
All right.
Yeah.
Thanks for joining us today, Sheila.
Yeah, thank you,
Appreciate
John.
it.